I joined the practice in August of 2000. So it was, you were one of my first
Yes,
patients.
yeah,
Really
and that's what they said.
there,
Well,
yeah.
this, we have a new doctor, and
Yes.
she has available appointments. Would you, would you like to see her? I mean, just meeting her, I just knew, loved her demeanor, and I just knew.
Can't remember a time that before you were my patient. So I just remember you being an early patient and just really enjoyed the visits with you, and we talked so much and learned a lot about your family. I had a daughter in June of the year that Sydney was born, and so we were kind of going through pregnancy together, and so it was always special to me to be pregnant at the same time as my patients. And so I think we just hit it off and had a great relationship from the beginning. And so it was really nice when Sydney started coming to see me, and we went through some teenage years together. And
it was when I sat down with Dr. Halderman and we talked, and we had conversation about my needs or what was going on, and her demeanor, her way she makes me feel comfortable even now. It just felt right. It just felt right. You have to have somebody who makes you feel comfortable, and I just know with Lori that I can talk to her, I can tell her anything. I talk to her like a friend, I feel like, and she's very comforting. So to me that's just, it's so important, and I'm glad that Sydney gets to have that experience as well.
I think I was like maybe 17 weeks pregnant, and we couldn't find his heartbeat, but we could hear him moving around in there. And so she's like, let's just get you in for an ultrasound. And she just sat in there with me the whole time. It's just like things like that. Like she just cares so much for her patients, for everybody, the whole family. So I wouldn't tell a lot of people, like, my doctor delivered me, she gets to deliver my baby. I won't ever forget the feeling I had whenever Dr. Halderman walked in at 3 a.m. to deliver my son. It was just so comforting. I just felt like so relieved, because I mean, it's scary delivering a baby, but then you get a doctor that you're so comfortable with, and it was just amazing. I love Dr. Halderman.
I love you too.
I just feel like I have such a positive doctor, and I mean, this whole company really is just all the doctors here are amazing, but I got blessed with the best, for sure. Even if Dr. Halderman is not able to see me, I mean, all the doctors are amazing. Like, I feel comfortable with any of them. But obviously, the most with Dr. Halderman. She saw me. She was one of the, first person to see me in this world?
To hold you.
Yes. And then she gets delivered. She delivered my first baby. She got to hold him first, see him first, and I hope it's the same way for my second one, too.
I was thrilled when she was pregnant and continued to see me so that I could deliver her baby. So she's my first patient that I've delivered that then I got to deliver, and that's a very special thing. That's something that when you're imagining, a lot of doctors imagine when they're in practice that'll happen, and you're like, ooh, that'll be really special, and so it is very special to me. So I will never forget you, either of you. It's just so special to me to get to, even if I hadn't delivered you, it was special because we have such a great relationship, but knowing that I've known your mom as long as I have, and that I'd helped, take care of you before you were born and delivered you, it's just so much more special to me to take care of you pregnant and deliver your babies and watch your family grow, and I can't wait to see what's ahead for you and your children, because it's the part of my job that makes the long hours worth it, and makes the hard parts of my job worth it are the relationships with my patients and their families, and seeing you grow up. I mean, I feel pride for knowing you as long as I have, and seeing you be such a wonderful young lady and a mom, and you're so good with your son, and I love to see that. So it's very special to me.